Hi everyone, my name is Dr. Nouris Lampe. Hi everyone, my name is Dr. Nouris Lampe, and today I'm going to talk about hyperhidrosis. We are located at the Horacio Aldebar Hospital in Aruba and in our private practice of dermatologists. Going to talk about hyperhidrosis and his treatment with signaling device. This is my disclosure. Hyperhidrosis is a disorder of excessive sweating due to the overstimulation of cholinergic receptors on eccrine glands. This disorder is characterized by sweating beyond what the body uses for homeostatic temperature regulation. The eccrine glands are concentrated in areas such as axilla, palms, sole, and face. But the eccrine glands is situated all over the body. It's only in this area is more concentrated. That's why the symptoms of hyperhidrosis, we're going to see them in these areas. What causes hyperhidrosis? We still don't know, but we assume that the acetylcholine negative feedback loop is likely impaired in this patient, which may explain how the physiological response can be pathologic, can become pathologic. We know that statistically it affects approximately 3% of the population in the United States. It might be higher in Japan. That's what it's the other records. And it have a very serious impact of quality of life. And that is very good stated. And it can have emotional, psychological, social, and occupational impact because of this super hyper sweating of hands, especially hands, because that's where we see it mostly. We classified the hyperhidrosis in primary and secondary. The secondary hyperhidrosis is manageable, and is most of the time is due to an underlying disease or an underlying problem. That's why to rule out this, the hyperhidrosis, you can do some tests to determine some secondary causes. The primary disease typically appears in early ages and it's more localized. The cause of primary hyperhidrosis is still unknown, as I said, but you can find some genetical stigma about family that can have also the same problem. It's much more common between 20 and 60 years old, and it doesn't make any difference if it's a man or a woman. The most affected area is, as I said before, is the palmar region, maybe for many other reasons. The physiopathology of the sweating, we can say as follows. The eccrine glands received a sympathetic innervation through the cholinergic fibers that sent impulses as a physiological response to the core body temperature, controlled during times of physical or physiological stress. The thermoregulator center of the hypothalamus mediates sympathetic innervation to the sweat glands. Cholinergic stimulation of the muscarine receptor-induced sweating. The hyperhidrosis involves hyperactivity of sympathetic nervous system, causing excessive release of acetylcholine from the nerve ending. This belief that the negative feedback of the mechanism to the hypothalamus might be impaired, causing the body to sweat more than what it's needed to cool off the temperature or to cool off the body. How do we diagnose a primary hyperhidrosis? The excess sweating, of course, it has to be more than 6 months. It involves axilla, palms, or on the face. That's where they're more concentrated. Sweating is bilateral or symmetric. There is no sweating during the night or very more, like say the amount of sweating is less during the night. The sweating episode lasts at least 7 days consecutive, and we just say that it started around 20 years old or older. There is always a family history about sweating, and it really have impact on his daily life activities. To rule out a secondary hyperhidrosis, we do complete blood count, we use metabolic panel, thyroid stimulating hormone, sedimentation rate, anti-nuclear antibodies, hemoglobin, we do chest rate. These tests may rule out any infection, kidney dysfunction, malignancy, diabetes, thyroid diseases, anti-inflammatory and an inflammatory disorder, or connective tissue disease. They all can be associated with hyperhidrosis. So treatment. We're going a little bit to treatment and not specifically. And there are topical treatments, there are oral treatments, and there are surgical treatments. Also, there are devices who can destroy acrine glands, and so we're going to go through that. Topical treatments, as first line treatment is aluminum chloride hexahydrate in 20%. They using it 3 or 4 nights. It will help reduce the sweating, especially on axilla. But a frequent use of the chlorine of the aluminum chloride will become intolerant, and the patient get irritation and may have contact dermatitis. The same thing with glucopyrronium toxalate. You can also have problems with contact dermatitis. The oral treatment is the oral anticholinergic medication that include oxybutyn 5 milligram, 10 milligram per day. This agent can cause dry eyes, dry mouth, urinary retention, and constipation. So it has this severe, very uncomfortable side effect. Nowadays, we use the botulinum toxin. It's very well known for his effect in hyperhidrosis. You can use it on the axilla, you can block on the hands. It's very expensive, and it has to be reapplied every year or every 2 years. Depends on how the patient comply and what does it does. It acts at the cleaving of the SNAP25 protein, blocking the cholinergic action. So it blocks the perspiration. Then we have the iontophoresis. Iontophoresis is You can use it with water or without. There's wet iontophoresis or dry iontophoresis. It has been a long time in the market. It was a device that they used to do it in office. Nowadays, we have it as a home device. You use it 3 times a week, and it has to be done constantly because it reoccurs all the time. So it's not so easy for the patient at all. The other therapies are surgery, and it's much more invasive. The more effective is the sympathectomy. Then we have the radiofrequency ablation, also the subcutaneous liposuction. As you see, it's very aggressive. It have a lot of complications. Complications are very common, and as you see, it involves the sympathectomy, involves the removing of ganglia, T2, T4, on the facial T1, then on the palmar 2 to 3, and on the axilla T4. So it can have a very dangerous side effect like pulmonary problems like bleeding, etc. It's a very aggressive or invasive procedure. As you see, it becomes more and more very expensive because it's an interprofessional team that they have to be present to treat these patients: dermatologists, surgeon, plastic surgeon, internists, you name it. And at the end, they all have to work on this patient, and at the end, it's very, very, very cost effective. And none of these treatments has proven to be very effective, very safe. In our study with the signaling device, this technology has proven in several trials that we've done and responses in neuropathic pain, in neuropathies, in paralysis, and especially in peripheral nervous impairment. Since we know that this technology work on nerve endings and especially on the ionization of the cells, we started a trial with several patients with hyperhidrosis, and it's a still ongoing research, and the results are very impressive. This is the paper we did. It's a double-blind trial with neuropathic problems, and we did also diabetic neuropathy with very good results. You can see we have used it in patients with burn wounds, which has improved very good, especially it works on wound healing and pain. And that's why we have enrolled 7 patients. The 7 patients were between 20 and 40 years old, women and men. It was 5 women, 2 men, and all of them with primary hyperhidrosis. We include them with diagnosis criteria for hyperhidrosis, and we rule out any secondary underlying disease. We gave the patient questionnaire. This is the questionnaire the patient had, and all 7 was in scale 3, where is tolerable, but it interferes with his daily activity. The treatment with the device was 3 treatments once a week for 15 minutes. There was no side effect during or post-treatment. The effect of the treatment, the result of the treatment was observed or felt immediately a few hours after the treatment. And the average lasting of the result was minimum a week to a year. So we still working on many patients, and we are recruiting still patients for treatments. And we can use this machine in any part of the body, axilla, palm of the hand, and there's no pain, no side effect. Here you can see how we do it. It's a very simple procedure, simple machine, where you can sit comfortable and with no kind of side effect at all. What is the mechanism of action in the signaling device? It works as we think is it regulates the cholinergic loop, restoring the normal function. That's why we think that the treatment improvement has been 80%, because the patient goes to excessive sweating to normal sweating. And we haven't touched with this machine any endocrine glands or any nerve, sympathetic nerves. So there's no destruction of any cells. So, conclusion, the IREPAIR signaling device is not only an alternative treatment for hyperhidrosis, it's also the safest, inexpensive, and very effective. We advise the wider and bigger research to determine effectivity and long-lasting effect. Gonna say some word on neuropathic pain in this device. This device has proven that indeed it works very good in neuropathies, especially in diabetic neuropathy. We have been proven that it works fantastic. Patients see results immediately, and the results are very long-lasting. Of course, the diabetic neuropathy is a pain that's very difficult to manage. Most of the time, we only manage with lowering blood sugar or blood sugar levels and pain management, with but there's no treatment for this neuropathy. And of course, it will always lead to severe complications. Of course, in all these devices who have been worked with to compare for these kind of neuropathy, they all work in one of the other with pain, but none of them has a long-lasting effect. You will always see that the treatments, after they stop it, the problem or the pain always come back. So we have confidence in this signaling device that resonate with the cells of the body. Okay, these are the results of our treatments, our trial with IREPAIR and neuropathic pain. You can see here, most of the patients had a very good result. There was only some problem in level of or intensity of disease, like patient had 10 years, some of them have 15 years, and you cannot measure the advance of the disease sometimes most of the time with side effect or complication. Then you can see how advanced the neuropathic problem is. But before that, it's always difficult to measure the neuropathic pain. So you can see the results are very promising, and the patient are very satisfied with our treatments. And of course, what we aim is to get a better quality of life with these patients. If you ever had the opportunity to treat a diabetic neuropathy, you know these patients hardly sleep at night. The pain is on one moment of their life is unbearable. So we know that it's a big problem. And in patients with burn wounds, also we use the technology, and you can see here before and after treatments. This device has, because it resonates on cells of the skin and body, and improve their function, so we can use it in wound healing. And as the wound healing goes along with the pain, so then you can see improvement also with the pain in this patient. And you can see another view. And thank you. See you soon for another lecture, and have a nice day.